Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about common gastrointestinal illnesses. Gastrointestinal infections are illnesses caused by people, animals, food, and water in the form of parasites, viruses, and bacteria. They commonly lead to symptoms such as diarrhea and abdominal cramps. There are more than 200 million cases of gastrointestinal illness in the United States each year. Populations at higher risk include those younger than age 5, pregnant women, those older than age 65, and those who are immunocompromised. They may be individual cases or outbreaks of illness, as they can easily spread from person to person. There are many ways for gastrointestinal illnesses to be spread. They may spread from someone not washing their hands well, such as after using the restroom. An infected person can transmit the germ to another person. Also, after caring for or playing with animals, as you may become infected from an animal, they may be carriers and may not be sick themselves. This also includes cleaning their cage, aquarium, bedding, or litter. Not washing hands well before and after preparing food, as it can be transmitted from an animal contamination in the food or from an infected person preparing food. And not washing hands well after caring for someone who is ill, as this can transmit from person to person through contact with the feces or changing the diapers. It is also spread through other person-to-person contact, such as close contact with ill household members at a daycare or a school, or sexual contact, including feces contact. It may be spread through the environment through soil contaminated with animal feces. It can also be spread through contaminated food and drinks, such as eating or exposure to raw or unpasteurized product, such as poultry, eggs, unpasteurized dairy and juice, and raw fruits and vegetables not properly washed. Also from not properly cooking food and not reheating it to a proper temperature, or not refrigerating food soon enough and leaving it out at room temperature for longer than 2 hours, or from water that is not treated, such as lakes, rivers, or pools if someone is infected and they swim while contagious. It can also be transmitted through contaminated surfaces, such as a cutting board, the kitchen counter or sink, toilet, and children's toys. Some germs live longer than others on surfaces. Common gastrointestinal infections include CAMPYLOBACTERIOSIS, CRYPTOSPORIDIOSIS, ESCHERICHIA coli, GIARDIASIS, Hepatitis A, NOROVIRUS, ROTAVIRUS, SALMONELLOSIS, and SHIGELLOSIS. CAMPYLOBACTERIOSIS is caused by the Campylobacter bacteria. It is one of the most common diarrhea illnesses in the United States and occurs more often in summer. There are about 14 cases diagnosed per 100,000 people each year in the United States. The incubation period is between 2 to 5 days, with a range of 1 to 10 days. Symptoms include diarrhea, which may be bloody, fever, abdominal cramping, and vomiting. Complications include dehydration, irritable bowel syndrome, which can develop in 5 to 20% of people, and arthritis, which can develop in 1 to 5%. About 1 out of 1,000 people develop Guillain-Barré syndrome, or GBS. This is muscle weakness and may be paralysis, and it may last weeks to years. It often requires intensive medical care, and some people may have permanent nerve damage. Campylobacteriosis may also spread to the bloodstream, causing life-threatening illness. Most people recover without treatment within a week, and there are some antibiotics for severe illness or those in a high-risk population. Cryptosporidiosis, or crypto for short, is caused by the Cryptosporidium parasite. It can survive outside for long periods of time and is one of the leading causes of waterborne illness. It is estimated that there are 748,000 cases each year in the United States. The incubation period is around 7 days, with a range of 2 to 10 days. Common symptoms include watery diarrhea, abdominal cramping, slight fever, weight loss, and vomiting. Dehydration is a possible complication. Most people recover without treatment in 1 to 2 weeks, although a medication called nitazoxanide is available by prescription if it is indicated. Escherichia coli is caused by the E. coli bacteria. Shigatoxin-producing E. coli is a common pathogen. This is where a toxin is produced which causes illness. 0157 is most commonly the identified strain. It is estimated that there are 265,000 cases of shigatoxin-producing E. coli infections in the United States each year. 36% of these infections are caused by the 0157 strain. The incubation period is usually 3 to 4 days with a range of 1 to 10 days. Common symptoms include diarrhea, which is often bloody, severe stomach cramps, and vomiting, and a low fever is a possibility as well. Complications include dehydration, and 5 to 10% of those infected develops what's called hemolytic uremic syndrome, or HUS. This is a type of kidney failure which may result in dialysis. It is more common in the very young and the elderly. It develops about 7 days after symptoms start, but once the diarrhea is improving. Symptoms of HUS include decreased urination, extreme fatigue, and losing pink color on the cheeks and inside the lower eyelids. Most people with HUS recover within a few weeks, although some may have permanent damage or it could lead to death. Most people with E. coli recover within 5 to 7 days. Antibiotics and antidiarrheals should not be used as they only increase the risk of HUS. Giardiasis is caused by the Giardia parasite. It is the most common intestinal parasitic disease affecting humans and is more common in the late summer. It is estimated that there are 1.2 million cases in the United States each year. Incubation period is 1 to 3 weeks. Symptoms include diarrhea, gas, greasy floaty stools, bloating, abdominal cramping, nausea, and weight loss. Dehydration is a possible complication. Most people with Giardia recover within 2 to 6 weeks without treatment, although treatment is used in some individuals. Treatment includes metronidazole, tinidazole, and nitazoxanide. Hepatitis A is caused by the hepatitis A virus. In 2015, there were about 2,800 cases in the United States. A vaccine became available in 1995, which has led to a decline in more than 95% of cases. Incubation period is 28 to 30 days, with a range from 15 to 50 days. Those who are infected are contagious from about 2 weeks before they have symptoms to about 2 weeks after symptoms end. Common symptoms include nausea, vomiting, fatigue, abdominal pain, fever, dark urine, pale clay-colored stool, joint pain, loss of appetite, and jaundice, which is yellowing of the skin or eyes. Hepatitis A may lead to hospitalization for acute liver infection, and death is rare. Most people with hepatitis A recover without treatment within 2 months. If someone is exposed, they may receive the vaccine or immune globulin within 2 weeks of exposure in order to prevent developing a case of hepatitis A. Norovirus, or viral gastroenteritis, was formerly called Norwalk virus. It is often referred to as stomach flu or food poisoning, but it is transmitted by infected people, not just food on its own. U.S. statistics include that there are 19 to 21 million cases each year. Norovirus contributes to 56,000 to 71,000 hospitalizations each year, and 570 to 800 deaths annually, mostly among young children and the elderly. It is more common in the late fall through winter. Incubation period is 1 to 2 days with a range of 1 to 3 days. Common symptoms include watery diarrhea, vomiting, nausea, abdominal cramping, fever, headache, muscle aches, and fatigue. Dehydration is a possible complication. Most people recover without treatment in 1 to 2 days. Rotavirus is the most common gastroenteritis illness in young children globally. It is more common in the winter to spring months. In the United States, before a vaccine was available, almost all children were infected by their 5th birthday. It led to over 55,000 hospitalizations and 20 to 60 deaths each year in the United States. After the vaccine was available, it decreased hospitalizations related to rotavirus by up to 90%, and there was an estimated 40,000 to 60,000 decrease in diarrhea-related ER visits among young children in the United States. Those children who are vaccinated may still become infected with mild illness. The vaccine protects against severe disease. Incubation period is about 2 days. Common symptoms include fever, vomiting, diarrhea, and abdominal pain. Rotavirus may lead to dehydration. Most recover without treatment within 8 days. Salmonellosis is caused by the Salmonella bacteria. There are many different serotypes, and Typhimurium and Enteritidis are the most common types in the United States. It is more common in summer than in winter months. In the United States, there are 1.2 million illnesses, 23,000 hospitalizations, and 450 deaths each year. Incubation period is about 1 to 3 days. Common symptoms include diarrhea, which may be bloody, fever, abdominal cramps, and vomiting. Complications include dehydration and reactive arthritis, which is pain in the joints which can last months to years, and it may lead to chronic arthritis. Those with reactive arthritis may also have eye irritation and painful urination. Most people with salmonella recover without treatment within 4 to 7 days. There are antibiotics available for those with severe illness or those in high-risk populations. Shigellosis is caused by the Shigella bacteria. In the United States, Shigella causes 500,000 diarrhea cases each year, with Shigella sonii being the most common type. Incubation period is 2 to 3 days. Common symptoms include abdominal pain, diarrhea, which may be bloody, vomiting, fever, and bowel urgency even when the bowels are empty. Possible complications include dehydration, reactive arthritis, and hemolytic uremic syndrome. Most people with shigellosis recover without treatment in 5 to 7 days, although antibiotics may be used for those with severe illness. When diagnosing a gastrointestinal illness, a physical exam will be done to analyze symptoms, food, recreation, and travel history, and vital signs. Blood tests may be ordered to check blood cell counts, check for complications, and in some cases to test for the specific germ. Stool samples may also be collected to test for the specific germ. You should call your doctor if you have diarrhea lasting longer than 2 days, diarrhea with high fever, bloody or black stools, diarrhea after recent foreign travel, yellowing of the skin or eyes, or signs of dehydration. Signs of dehydration in adults may include dry mouth or skin, little or no urine, weakness or dizziness, or fatigue. Signs of dehydration in young children may include not having a wet diaper in 3 or more hours, having a dry mouth and tongue, crying without tears, being drowsy or unresponsive, or a sunken appearance in the abdomen, eyes, and cheeks. You should also call your doctor anytime you're concerned. To prevent gastrointestinal illnesses, you should always follow proper hand washing by scrubbing your hands with soap and water for 20 seconds using warm, clean, running water. You should wash your hands after using the restroom, before and after preparing food, after touching animals or having contact with their belongings, and after changing a diaper or caring for someone who is ill. Always thoroughly cook foods using a thermometer to check the internal temperature. Do not prepare food for others while ill to prevent spread to other people. Always be on the lookout for sick children at school, daycare, or nursery, if your children attend there or if you work at one of these facilities. Avoid raw or unpasteurized dairy and juice products. Avoid swallowing water in pools, lakes, ponds, etc. Be sure to always clean food preparation surfaces before, during, and after food preparation. Be sure to wash the cutting boards between foods, wash utensils between foods, clean other equipment, and clean the counters. Keep cooked and raw foods separate. Do not clean animal cages in the sinks, bathtubs, or on food prep surfaces, especially reptiles. Go to routine vet visits for your pets to check for parasites, and go to sick visits if they are symptomatic. Follow safe hygiene rules when traveling, including using bottled drinks and water even when brushing your teeth, only consuming raw vegetables and fruits when you yourself peel them. Do not consume food or drinks from street vendors, and do not use local ice. Also, obtain a vaccine when it is available. Remember, just because the symptoms are gone does not mean you are no longer contagious. This concludes the gastrointestinal illness presentation. If you have any questions or concerns, please contact your doctor, local health department, or visit any of these websites. Thank you.